Okay, welcome to the next section on the superficial back arm line. And in the last part, we talked about the superficial back arm line's connection with the lateral line and how this relates to the gallbladder and jiao meridians. Now, in this section, we're going to look more at the large intestine meridian and how points on this channel can affect and treat the conditions that they do. So to begin with, it says SBAL, that stands for superficial back arm line. It consists of the large intestine and jiao meridians. Many points on the large intestine and jiao channels treat low back pain, sciatica, neck, and shoulder pain. These points include Yao Tong Xue, Luojian, Sanjiao 3, and Sanjiao 5, as well as Ling Gu and Dabai, which we've already discussed, which are essentially similar to Li4 and Li3. And then there's another group of points in the region of Li13 to Li15 that we're going to talk about here. And they're known as the extra bone spur points. That's what Brad Wisnick calls them. Or they're also referred to as the straight spine 3 needles, which is what Marr calls them. So these 3 points are used together as a Daumal, and they're in the Li13 to Li15 region. And we'll take a closer look at them, but what I want to emphasize here is that all of these points have similar functions in that the way they treat the neck and the back or the throat, and these again correspond with our principles of imaging as well as the superficial back arm line and what we can learn about the fascial plane model. Now let's read what I wrote in the red box here. It says junction points. From a fascial plane perspective, muscles on the large intestine and jiao channels converge at the elbow. The connecting fascia travels up the inner muscular septum between the biceps and triceps and then meets the deltoid. Near here is also the insertion of the latissimus muscle on the bicep groove. So the muscles of the forearm on the yang side, they converge into the area of Li11. And then from there, we've got a fascial tract that runs from the elbow up to the deltoid. And you can see in the image there that this is just a thin tract here that is between the biceps and the triceps. Well, related to this, and part of the reason that these points on this fascial plane are so effective for lower back pain is because the latissimus dorsi actually attaches onto the humerus. And we can feel this in a very direct way. So let's take a look at the next slide. We're going to do a little experiment here. And this image shows the picture of a bodybuilder who's doing a lat pull down. And for any of you that go to the gym or are into lifting weights, you know that when you're working your back, you'll often work your biceps at the same time. And that's because of this relationship between the pulling action of the back muscles and the biceps and the way that they get involved in this. Now, this is all related to the superficial back arm line and the way that these points can treat the back. So as we did before, let's do this experiment where we clench the fist really hard and contract the muscles of the forearm and contract your upper arm muscles, your biceps and your triceps, and just squeeze really hard. And notice that that will cause a tightening and a contraction in the latissimus. Now, the last time we did this exercise, we were paying more attention to the traps, and I purposely didn't say anything about the lats, but just as you do this, notice now that the lats are also getting involved just by squeezing the arms and contracting them. So this is a really simple and very clearly effective way to feel this fascial plane inside your body in the way that the arm muscles and fascia connect to the back muscles and the traps and the lats. Let's look a little closer at this on the next slide. And it reads points on the superficial back arm line. So here on the left, you see an image of the humerus. And this is an anterior view as well. And if you can zoom in on that, on the upper part of the humerus, you'll see just above the attachment for the deltoid, you'll find that in the middle of the anterior portion of the humerus is the attachment for the latissimus. And then just lateral of that is the attachment for the pectoralis major, and medial to the attachment of the latissimus is the teres major attachment. So what appears to be going on here then is when we needle these points on the superficial back arm line, it's sending mechanical and fascial signals up the arms and to this intermuscular area between the biceps and the triceps, as we can see in the image here. And then at that point, it's able to affect the latissimus and cause beneficial results in the lower back area. So Li14 is a really interesting point here because it's listed as a meeting point for the large intestine, small intestine, and UB channels. Now, Li14 is about 7 sun above Li11 on a line drawn from Li11 to Li15. Here I've put the point locations from a couple different sources, the first one being from a manual of acupuncture. So we can see that this Li14 point is a really interesting one because it largely overlaps with the bone spur points, because that third point is 6 sun above Li11. So right in this area of 6 to 7 sun above, we find these meeting points and this convergence of this fascial plane meeting up with the latissimus muscle. Let's take a look at the next slide, where we see points on the superficial arm lines. So these are the points on the large intestine channel, and we've got Ling Gu and Da Bai, and we're all very familiar with those by now. So they treat low back pain, sciatica, and general back pain, as we know. We can use them for low back pain. Also, they're commonly supplemental for upper back pain. They may not be the best points for upper back pain, but they certainly can be beneficial and play a role in that. The respiratory conditions, that's the lung, large intestine link. But we need to understand, too, that I've put an image of the superficial front arm line here. So as we needle the large intestine points like Ling Gu and Da Bai, it's sending this signal up in this area of lung 3 and lung 4. And then from there, the signals are getting sent over to the latissimus attachment as well as to the attachment of the pectoralis major. So this likely plays some role in its role in treating lung conditions. Now, as we know, they're also indicated for gynecological conditions, irregular menstruation, dysmenorrhea, as well as neurological conditions, headaches, trigeminal neuralgia, hemiplasia, and chronic conditions of qi stagnation. Now, I'm not going to go into too much of an explanation here about the gynecological and neurological stuff. That gets into other aspects of the fascia and even into the hormones and different ways in which acupuncture works. But we can also trace these things out fascially into the reproductive systems and how that works. But I'm going to save that for another time. So one thing that Tom Myers hasn't presented here is how this connects to the muscles of the head and of the face, and there we'll rely on our understanding of the meridian pathways and the meeting points in the 6 systems. The next group of points here, we've mentioned them already. I want to go through them again and look closer at the indications, are these bone spur points or the straight spine 3. Now, this is a great Dao to use for more chronic conditions, and we find it indicated for periostitis of the vertebrae, degenerative spinal and disc disease, reduced range of motion, sciatica, scoliosis, and chronic pyelitis. So what we notice about all these indications, these are more deep, chronic type conditions. So again, we find that generally speaking, that the more distal points are useful for treating acute conditions, and the more proximal points are typically and generally indicated for more chronic conditions. And I find that to be the case with these points too. Ling Gu and Da Bai can be very effective for those acute lumbar sprains, but often for more chronic conditions, you don't get the response out of them so well. They can certainly play some role in it, but don't be surprised if you're treating chronic low back pain and you're not getting a result with Ling Gu and Da Bai. So some of the options that you can do then is to use the bone spur points. So they're more proximally located, and they're also indicated for more chronic type conditions as well. So remember to use those points. Now, the other point that I want to make here, and we'll go into the detail in the next section, is that if you're not getting results with treating back pain by using the points on the superficial back arm line and on the large intestine and San Jiao meridian, and start to look to using the small intestine points because they're on the deep back arm line. So clearly distinguishing between the 4 fascial arm lines and what meridians are on there and at what levels they work is a very good way to refine your treatment strategies so that you can choose the best points, even right from the start. When you first start to learn about these fascial connections and you first start to learn about Master Dong's points and the 6 systems of Dr. Tan, you have to experiment with a bit and test it out and see what works and integrate your understanding and knowledge of it. And I've just found that by incorporating these fascial planes into it, it helps me to know which points to use much better than if I'm just using one diagnostic method of syndrome differentiation. Now let's read what I wrote in the box here. It says, the junction point on the humerus where the superficial back arm line, large intestine, jiao points meet with the lats is one of the most important junctions to understand. So I think this is fairly clear by now how this is working through the fascial planes and how the superficial back arm line points can treat neck pain and upper back pain and low back pain. Now for upper back pain, it gets a little more tricky, and often we'll find that the lung points work better for this. We'll talk about that later. So for now, let's go ahead and take a look at the next slide. And it reads, Dong's points on the superficial back arm line. Now these are the Jiao meridian points. We've already talked about these, but let's just go through them again. 22.06 and 22.07 on the hand, treat neck pain, back pain, and spinal pain, and spurs in the vertebrae. So we do find it indicated for a chronic condition here with the spurs. And again, a lot of this, the details of this and the details of how this is working on a micro level isn't completely understood. So if we develop a foundation of the anatomical relationships that exist with the fascial planes and how they overlap with the meridians, we're developing a strong foundation for ourselves. And at the micro level, then, there are going to be differences between the jiao points and the large intestine points, even though they're on the same channel. So typically we talk about, you can use the jiao points for treating gallbladder meridian sciatica, and for sciatica in general, you would use the large intestine points. So with our clinical experience and the knowledge and the wisdom of the Master Dong points, we can already understand some of these things, but the more that we can understand about the way this works on a micro level, the more that it can help us to also better understand what points we should be using. So a lot of times you can just follow the muscle fibers, and when you start to understand more about it and these cross patterns that exist with the muscles and the way that the muscle fibers themselves are aligned and orientated, that can help you to learn about how these points work if you're looking for a deeper explanation. So 33.04, 05, and 06, we spoke about these points. They treat chest pain that penetrates to the back. So that's that trapezius intercostal pericardium jiao connection that's going on there. Sense of stuffiness and oppression in the chest. And, I always compare these points. I mentioned the case study with 3308 and 3309 in the last section, and these points can be used the same. So when you get these types of conditions, the way that the tensegrity works in each person and the way that the tension in the system lands upon groups of points, it's always a little different for everyone. So the jiao points are easy enough to palpate as well. And if you're asking about the client's top 3 concerns, this can also help you to understand what points you should use. So in that case study in the last section, I mentioned how I used 3308 and 3309 for chest pain on the left side and in the area of the heart. And the reason I chose the left side is because he was also having right side elbow pain. So if he wasn't having elbow pain, I may have used 3304 through 3306, but because he was having elbow pain, I chose those points that are closer to the elbow. And when I needled them, I didn't even say anything about these points treating the elbow, but when I needled those points on him, he felt chi sensation. He felt something going on over on the other side of the elbow. So when you ask the patient about their top 3 concerns, then it helps you to distinguish between what groups of points should be used. Now, if he would have complained of neck pain or some other condition that indicated that I should use the points on the forearm, these 33.04 or 05, like if he had carpal tunnel syndrome, then I would have been more likely to use these points. So again, asking about the top 3 concerns is a really important way to help you decide what groups of points are best to use. 33.08 and 33.09. Gallbladder sciatica, we've talked about this. I think this is all clear by now. Peripheral neuropathy and heart conditions, rib pain, systematic stagnation. So yeah, try just using these points in your clinic for a day or for a week and look at people's patterns, and especially systemic stagnation and liver stagnation patterns where the gallbladder is affected. You can use these points as well, and I think you'll be happy with the results. So that includes everything I want to talk about in this section. In the next part, we're going to speak about the deep back arm line and the small intestine meridian.